The following materials are prepared before inserting an intravenous fluid line. Non-sterile gloves. An intravenous catheter equipped with a three-way tap. Take note that intravenous catheters come in different gauge sizes. The lower the gauge number, the bigger the needle. Sizes usually range from 24 gauge, which is most commonly used in pediatrics, to 16 gauge, mostly used in the intensive care unit or the operating room. 18 is the most commonly used gauge. This size may be used to administer blood and also allows drugs to be administered quickly. Here, a 20 gauge intravenous catheter and a 22 gauge intravenous catheter are shown. A tourniquet. Take note that here, a disposable tourniquet is shown, generally used for patients who have to be treated in isolation. An infusion set. A bag of intravenous fluid. Take note that in this demonstration normal saline was used. Intravenous catheter dressing, alcohol used as a skin disinfectant, gauze swabs, a sharps container. Also take note of the separate three-way tap which may be necessary if the intravenous catheter is not equipped with one, an intravenous line stopper, a vacutainer needle in case blood samples need to be taken as well, and 2 laboratory tubes. Prior to inserting the intravenous catheter, the intravenous fluid bag is prepared by spiking it with the infusion set. The intravenous fluid bag has an intravenous tubing port and a medication port that has a silicone filling which closes it off immediately after removing the needle. Care must be taken to always check the medication label for the name of the medication, the dosage, and the expiry date before use, in order to prevent medication errors. Take note of the infusion set. It has a spike which is covered by a plastic cap, a drip chamber which shows the infusion rate during infusion, the additional medication ports on the infusion set that are equipped with Luer locks. Take note that not all infusion sets are equipped with additional medication ports. The 2 pinch clamps which may be used to close off the intravenous line completely, and the roller clamp, which is used to regulate the infusion rate. If the wheel is rolled towards the narrow side, the line is clamped off, and if the wheel is rolled towards the broad side, the line is opened. Finally, take note of the intravenous catheter connection on the infusion set, which is used to connect the infusion set to the intravenous catheter itself. The plastic cap protecting the port of the intravenous fluid bag is removed. The plastic cap protecting the spike of the infusion set is removed. And the spike is inserted into the intravenous tubing port on the intravenous fluid bag. After inserting the spike, the drip chamber is rotated 180 degrees to allow the chamber to fill up. It is advised to rotate the drip chamber 180 degrees in order to prevent bubble formation in the infusion set. It is advised to slightly open the intravenous catheter connection cap prior to inserting the spike, in order to create an open system. In a closed system, the fluid will not flow. The connection cap is usually already slightly opened as a default setting when it comes out of the sterile packaging. Take note how the infusion set fills without any bubbles when using this technique. It may also be advised to briefly remove the intravenous catheter connection cap in order to completely flush the infusion set. Care is taken to maintain the sterility of the IV catheter connection. Jewelry or pinching clothing is removed from the patient's arm and it is positioned. The veins in the arm are occluded by applying the tourniquet. Take note that in this demonstration a reusable tourniquet is used. Care should be taken to prevent the patient's skin getting stuck in the buckle of the tourniquet while securing it. This may be done by pulling the buckle away from the patient's arm or by placing a finger in between the buckle and the patient's arm. The hand and forearm are examined using inspection and palpation to identify a suitable vein. A good light source will aid in visualizing the vein, but palpating them and feeling for their typical spongy firmness will be most helpful. It is easier to palpate the vein without gloves on. It may also be helpful to ask the patient to make a fist in order to make the veins stand out more. Take note of the cephalic vein, which can now be clearly seen. It is advised to put gloves on after determining the intravenous cannulation site. The skin is disinfected at the chosen intravenous site. Care should be taken not to touch the puncture site after disinfecting it. If this does happen, disinfect again. The needle is inserted into the vein at an angle of approximately 30 degrees until blood is seen in the flashback chamber. It is advised to anchor the vein using the thumb of the non-dominant hand. This will prevent it from slipping out from under the needle. It is then advanced 1 more centimetre into the vein at a 10-degree angle. Take note of the blood in the flashback chamber. The intravenous catheter needle inside the cannula is retracted approximately 1 centimetre while keeping the catheter in place. The cannula is then inserted into the vein. The catheter dressing is applied to secure the intravenous catheter. Take note how the dressing is applied, with a translucent window overlying the intravenous site, in order to be able to inspect it for signs of infection. The needle is removed and discarded in the sharps container. The tourniquet is then released. The intravenous catheter connection on the infusion set is secured to the 3-way tap on the intravenous catheter. Take note that both the 3-way tap and the infusion set are closed when securing them, in order to prevent blood or infusion fluids from leaking out. The intravenous catheter is flushed by opening both the 3-way tap on the intravenous catheter as well as the pinch clamp on the infusion set, and it is then set to the desired infusion speed. It is advised to secure the infusion set with an additional plaster in order to prevent the intravenous catheter from dislodging easily. Care must be taken to check for a possible swelling at the intravenous cannulation site, indicating the intravenous cannula was not inserted correctly and that the infusion fluid is running subcutaneously.